My name is Caleb Dunn, and today we're going to talk about epilepsy, some of the treatments that you can use for it, and also we'll talk about some of the ways that you can diagnose epilepsy. So epilepsy is a common disorder, and this will affect around 31 to about 60 people per 100,000 people every year. And it's estimated that 7 to 8% of the population will experience an epileptic seizure at least once in their life. And these can be categorized into two main types of seizures, and these are primary generalized and partial seizures. And partial seizures can further be categorized into two different kinds of seizures, which are simple and complex seizures. As simple seizures, these occur at neocortical structures, and these can affect spatial reasoning, speech, and sensory perception. And complex seizures, and these can be categorized by loss of consciousness, and these are usually more disabling than simple seizures. And primary generalized seizures are occurring at both cerebral hemispheres rather than just one, and these are likely to be associated with a family history of seizures. And epileptic seizure disorders can also be associated with structural brain lesions, infection, traumatic brain injury, and generalized developmental abnormalities. So substrates of epilepsy can be found with greater accuracy using an MRI, and because of this, MRIs have often become the standard used to help diagnose epilepsy for high resolution imaging. And some imaging techniques such as positron emission tomography or a PET scan can also show brain activity in different areas. And an EEG can also measure brain waves in different areas of the brain, and this can also be used as a pre-surgical way to diagnose epilepsy. And if you can find the origin of the seizures in your brain, a surgical procedure can also be used and can actually be successful in treating epilepsy. And some of the ways that they can do this through surgery is by removing a brain tumor. You can remove the affected area of the brain, and you can also separate some of the nerve fibers, which will help prevent nerve impulses from causing the seizures. And this can possibly eliminate the seizures, and it can also decrease the risk of accidental death because of a seizure. And doctors can also prescribe anti-seizure medication to help try to prevent seizures. So the prognosis of epilepsy is actually pretty good, with 65 to 85% of the patients entering long-term remission and an even greater percentage entering a short-term remission of epilepsy. And if you can diagnose it early, the chances of entering long-term remission is even greater. And also that the longer the time that a patient is in remission, the less likely that recurrence will occur from this. And however, the longer that you have epilepsy active in a patient, the less likely or the poorer the long-term outlook is for epilepsy. And it also has a high mortality rate in the early years of epilepsy after you're diagnosed with the disease. So a way that you can treat epilepsy is through a physical exercise program, and this can provide physiological and psychological benefits to a patient. So people with epilepsy that are active are generally less likely to have seizures than inactive people. And they can also obtain the same benefits as healthy people, such as an increased work rate, and can also get a lower heart rate. And epileptic patients that use an exercise program are also less likely to be depressed because of the release of certain chemicals such as serotonin, noradrenaline, and it can also reduce stress in the patient. So that was just an overview of epilepsy and some of the ways that you can treat it. Thank you for watching.